Now, as the discussion around how to respond to the coronavirus coincides with the Democratic primary between Joe Biden and Bernie Sanders, who both have very different ideas on how to actually do healthcare in this country, public health experts are now making a case that countries with universal single payer healthcare systems are better suited to respond not only more effectively but efficiently to outbreaks than other systems, for example, our own. Now, according to the Washington Post, experts are saying that while it is too soon to see definite outcomes among competing healthcare systems, even in this early phase, they say that single payer state run systems are proving themselves relatively robust. Unlike the United States, where a top health official told Congress that the rollout of testing was failing, and where Congress is now only moving through a bill that includes free testing. The single payer countries have been especially nimble at making free or low cost virus screening widely available for patients with coughs and fevers. Countries with forms of single payer, they also write, like South Korea and Denmark, have for weeks been offering drive through testing and other innovative mechanisms, allowing them to quickly test hundreds of thousands of their citizens to respond accordingly. South Korea, for example, has been testing anywhere from 10 to 20,000 people a day. In America, we've unfortunately done just about a fraction of that. And a lot of it is because we don't have testing kits. The president refused to get testing kits from the World Health Organization. And so, I mean, we don't have the ability to test high numbers of people. And not only that, but a lot of people actually can't afford to get tested. For example, people with insurance can somewhere cost $500 to $600 or at least upwards of $200 to get tested. That's with insurance, and that's assuming that deductibles are waived, which we don't know will be the case. But if you're uninsured, it can cost up to $1,600 to get tested. In a country where 40% of Americans can't afford a $400 emergency, can we really even afford to get tested? I mean, look, on the other hand, can we afford to not be tested? And that really here is the situation with American healthcare systems, right? So now, let me go to the situation here in South Korea. I mentioned them, right? Now, their response says, and this is from Choi Jae-wook. I don't know if I said his name right, who's a professor of preventative medicine at Korea University in Seoul, says, quote, unhampered government intervention into the healthcare sector is an advantage when the virus is spreading fast across the country. So that's one expert, right? So already you have somebody in, a country that is efficiently testing people and has a single payer healthcare system. So let's get to more experts, right? So Denmark is another country that was named in this, that was doing testing. And let's go to Jørgen Kritsals, the head of the University of Copenhagen Medical School, told the Post that the strength of Denmark's single-payer system is that it has, quote, a lot of really highly educated and well-trained staff, and given some quite undetailed instructions, they can actually develop plans for an extremely rapid response. So it's not just about being able to go to the doctor. It's also about coming up with a rapid response plan instead of having to go to insurance companies, the CEOs, as Trump has been doing, meeting with them to try to figure out how we're going to get, all these people tested and how much it's going to cost for people, having them come up with the formulas of how much to charge those or waive deductibles, et cetera, et cetera. It's really complicated here in America, but in Denmark and South Korea, since they only have one major insurer, the government, it's actually a lot more simple for them to get together, people to get together and figure out how to have a response to this. So now, even then, right? Let's see. Kurtzall adds, we don't have to worry too much about whether this response or that response demands specific payments here and there, as I had just mentioned, right? Just talked about. Now, he also says, we're aware that there will be huge expenditure within the system, But we're not too concerned about it because we have a direct line of communication from the national government to the regional government to the hospital directors. And so again, you've got those open lines of communication. You don't have, like we said, like we have a multi-payer system where you have to contact 20 different insurance companies in one area. That's not to say that though there aren't issues in countries with single payer with dealing with a pandemic. You've got issues of bed shortages, staff shortages, supply, all that. But then again, that's only a situation you're going to see with any pandemic. You're going to have massive stress on the system with something like coronavirus. That's just what happens. What's going on in America, though, is basically showing when something like this meets a system that's already broken, that can't really be stressed anymore because it's already fractured into a million pieces. And so what happens in that situation? Well, we're about to find out. And I have a feeling that it's not going to be good. More experts here. David Fisman, an epidemiologist at the University of Toronto, says that in a time of crisis like the coronavirus pandemic, having a healthcare system that's a public strategic asset rather than a business run for profit allows for a degree of coordination and optimal use of resources. Dr. David Himmelstein, co-founder of Physicians for a National Health Program at the Distinguished Professor of Public Health at the University of New York at Hunter College, said in a statement that the fragmented system in the United States leaves public health separate and disconnected from medical care and provides no mechanism to appropriately balance funding priorities. As a result, public health accounts for less than 3% of all overall health expenditures, a percentage that has been falling for decades and is about half the proportion in Canada or the UK. One result is that the state and local health departments that are in the front lines dealing with epidemics have lost 50,000 positions since 2008 due to budget cuts. So all of that stuff, all of those experts are 100% correct. Our system is inefficient, costly, and dangerous. It is a disaster. Now, look, we're going to get through coronavirus, right? Of course. There are now emergency measures being put into place. This is a national emergency. We're going to figure things out. But understand, right, that this system, our system in America, can only deal with things in a positive way if there's a national emergency. The problem is that the response to at least this coronavirus epidemic or pandemic was really slow in declaring national emergency in order to get help to people who's needed. And right now, we're already struggling and failing to do so, to get it to that level. What's going to happen with coronavirus 20, coronavirus 2021, or whatever new disease gets unearthed by the melting glaciers in Antarctica? Because you know it's going to happen with climate change, right? So what's going to happen? Our system is going to continue, since it's broken, continue leading us in a national emergency after national emergency without that infrastructure in place to take care of the basic needs of the people. And that's not even counting the fact that 68,000 people still die without health insurance in this country, even with the absence of a pandemic. And so I know a lot of people are worried about going to the doctor, right? But here's the thing. Millions of people are already worried about going to the doctor. Those who can't afford high copays and deductibles, right? And those who don't have insurance in the first place. Now, other people who do have insurance are thinking, boy, I can't go to the doctor. I mean, I don't know if I should get tested for coronavirus. I had a cough earlier. Oh no, right? I can't afford to do it. People with insurance, with decent jobs and supposedly decent insurance, not to mention all the people with junk plans, they're basically lumped in with the uninsured because those plans don't cover anything. And a lot of people I think are going to learn the hard way about those junk plans. And so that already, I mean, this entire situation is just laying bare the disaster that is our healthcare system that is run for profit. And so, I mean, even without this national emergency, it was still an emergency. It just wasn't called that. It just wasn't given attention by Washington. And the thing that struck me, since there was a debate last night, is how Joe Biden had basically laid out the case for universal single-payer healthcare by hearkening to this emergency and saying, we're going to do all that stuff that is involved with the single-payer healthcare, but only temporarily. So once this thing is over, then you're back to being on your own. You have cancer, well, that's your emergency. You have, diabetes, that's your emergency. Can't afford your insulin, that's your emergency. But hey, if you have coronavirus, that's an emergency. I don't see those things as different. I see them all as one and the same. A personal emergency in healthcare is a national emergency in healthcare. And the fact that we don't have Medicare for all, I think, is the national emergency. Hey guys, hopefully you enjoyed that free video. Now I'm going to have to ask you a favor. Between the demonetization and the YouTube algorithm messing around with view counts, etc., we're having a hard time adjusting to the new YouTube reality, which is where you guys come in. See, we have a Patreon, patreon.com/TYTNation, set up to help us rely on you guys, the viewers, instead of big corporate ads. Look, you know the show. You know I'm not in favor of big corporations anyway. So help us transition away from relying on the ad model to pay the bills and sign up to be a patron, patreon.com/TYTNation. That goes a long way to help us keep the lights on. And you guys will know that you're supporting independent progressive media.